Hi, I'm Dr. Robert Nucci from Nucci Medical. Today we're going to talk on our coffee talk. I have styrofoam today, so it's an invisible styrofoam. It disappears, which makes it harder to drink. We're going to be talking about the causes of sciatic pain. And sciatic pain is that burning pain that you would get or someone would get from the buttock down the back of the leg, and often into the foot, top or bottom of the foot. And sciatic pain is pretty common. It's pretty common. Fortunately, usually gets better, but it's a common thing. And there are causes of sciatic pain. The most common cause, and the one that one would think of first, is disc herniation. Disc herniation pain. I have my little model, which we've used before. Here's our model. Our model is translucent too, but there we go. I got it right that time. Okay, let's get my pointy pen out here. Maybe get my pen out. Okay, I'll try to get my pen out. There we go. We got it. Okay, this is the vertebral body, the block, and there's another block that's in your low back, right? This is the disc. That red thing in here is the disc. This is the back of the spine, little spinous processes that if you run your finger down your back, for the little bumps, those little bumps. And here is where the nerve comes out and goes into your leg. And that nerve, and actually a collection of nerves above and below this, essentially, come together, they all come out and then they group together into your sciatic nerve, which comes out of the back to the buttock and down into the leg. Now, the most common cause of sciatic pain is a disc herniation. I'm going to see if I can do this with my little model. There we go. There is the herniation, this huge bubbly herniation hitting the nerve that goes out of the back into the leg. That would give you sciatic pain because it's squeezing that nerve and irritating that nerve. More irritation than squeezing, but irritates that nerve, and that causes that sciatic pain. It can also cause numbness and so on. That is the most common cause of sciatic pain, is pressing on the nerves, or one or more of the nerves that go into the sciatic nerve. They come together and form the sciatic nerve, and that goes into your leg. And it's very, very common. That's the one that almost not only always comes to mind, but it may be the only thing that comes to people's mind. But there are other causes of sciatic pain and things that mimic sciatic pain. One of the classic ones actually is the herpes virus. You can get shingles. Shingles can give you sciatic pain because it's the virus. The shingles virus is in the nerve and in many nerves, and it can become active and give you sciatic type pain. So you need to think about that if you have sciatic pain. But there are also other things that can mimic sciatic pain, and I think you should maybe think of it this way: the nerve is coming out of the back. It's pinched up top, what we just discussed with the disc herniation. It's pinched up top. But that nerve travels down the leg and branches off in different directions, but travels down the leg and then goes into the foot. Anywhere along the path of that nerve, it could be injured, irritated. Sometimes people have injuries to their peroneal nerve, their common peroneal nerve around the knee. Get hit in the knee from the side, and then they get numbness and pain and so on in their leg and their foot. And that's similar to sciatic pain. Now, it's not all the way from the top to the bottom. It starts at the knee and below, but it can mimic sciatic pain because sciatic pain isn't always classic. It's not always from the buttock all the way down into the leg. It could be a bit patchy or different in different people. So when you see that, well, that pain in the leg, that can mimic sciatic pain. So the nerve being pinched at any location along the path of the sciatic nerve can mimic the pain distal to that, beyond that, like sciatic pain. So one must, think about that kind of thing. Those would be maybe the two more common ones. And then there is ones that are mimic sciatic pain in a somewhat of a different way. There is something, I think we may have done the coffee talk on this one, piriformis nerve pain. Piriformis nerve is in the buttock, and the sciatic nerve goes right behind it, essentially, as it exits the buttock and goes into the legs. You got this sciatic nerve going, let's try it this way, and the peroneal nerve is like this. Excuse me, pardon me, I keep saying peroneal nerve, pardon me. The piriformis muscle is in front of it or in back of it, depending on how you're looking at it. And if the piriformis muscle gets irritated or swollen, it could press that sciatic nerve and give you symptoms of sciatic pain, buttock pain, and so on. So you start to think, well, maybe they have sciatic pain, but it's actually a piriformis, and there's tests you can do to figure that out. Another cause of leg pain, which sometimes mimics sciatic pain, is arthritis in the back, lumbar stenosis. You may have you saw a little model here with the disc popping out. So we can do it again, and it hits the nerve. Well, imagine that there's a lot of arthritis in here. This hole has a lot of arthritis in it, squeezing the nerve from arthritic spurs. That can give you leg symptoms too. They tend to be different than sciatic pain. Sciatic pain classically sort of goes burning pain down into the foot. That kind of pain tends not to be, and it tends to be on both sides because you get arthritis on both sides of your spine, while sciatic pain tends to be more on one side. And it tends not to go into the feet as the same kind of way, and it tends to be slowly progressive and so on and so forth. There's ways in which you can make the diagnosis. But people with arthritis in their back may have leg symptoms that mimic, again, sciatic pain. So lots of reasons the leg can hurt. It's not always a disc herniation, not always the most common cause of sciatic pain. It can be other things. We mentioned the piriformis muscle. We mentioned pinching of the nerve at different places along its course into the leg. We mentioned the lumbar stenosis, arthritis, and we mentioned virus, right? Herpes virus. Now, there are other things too, more or less common things that can cause it that one really usually doesn't think about, but you have to think about everything if you can't make the diagnosis. You can have tumors that press on the nerve, of course. You can have infections that press on the nerve. So this kind of thing. Direct injury to the sciatic nerve is very painful. There's, I think, a newer name for it now, but in the past, and maybe still, you'll call it causalgia when you injure your sciatic nerve directly from. When I was in New York in trauma center, people get shot and a bullet hits their sciatic nerve, very, very painful, causing severe sciatic pain, but it's not from a disc herniation, obviously. It's from direct trauma to the sciatic nerve or transection of all or part of the nerve. Very bad, but can mimic sciatic. What should be one of the causes of sciatic pain can mimic disc herniation pain, at least theoretically, if you don't notice the bullet hole, I suppose. But in any case, these are potential causes of sciatic pain. But the most common is disc herniation. And that's what spine surgeons do treat a great deal, are disc herniation pain different ways, which would be another coffee talk, so to speak. I think that's about the gist of it. And there was always weird ones that maybe don't come to mind right now, but those are the ones to think about if you have that leg pain. And let's see if we have any. I see no one here. My little thing is blanked out today. Maybe there's 100 people and maybe there's nobody, but it's all blanked out. So I don't know if anyone's there, but there may be some questions that some have. I think there are. Prove that you exist. Here's somebody who proves that they exist. Fantastic. We have at least one person. I think there's quite a few actually. Sciatic may mimic hip pain. That's a good question. We talked about hip pain in a previous coffee talk, I think maybe the last one actually. And the hip pain is one of the causes of low back pain. Somebody has low back pain, you have to examine their hips because the hip can refer pain to the back and vice versa. Hip pain does give you groin pain and give you pain in the front of your leg, but you can give pain down in different parts of the leg, and people complaining of leg pain, hips are one of the things you would examine when you're doing your entire low back exam. So it doesn't mimic sciatic pain or cause sciatic pain directly, or it doesn't cause the symptoms of sciatic pain, but it does cause leg pain. And as I said earlier, sciatic pain can be a little bit different in different people. And it's one of the things you'll just have to think about when you're examining someone as a cause of the leg pain is hip pain. And as always with patients, you can have more than one problem. You can have two problems or three or more. So you could have hip problems and sciatic problems both, and they wrap over each other essentially. I have another question. Okay, what is this one? What would, hold on here, what would cause pain in the buttock and numbness in the foot? Well, there's lots of causes of pain. You can just think of a trauma can cause pain, all kinds of things can cause pain. From the standpoint of what we're talking about, we covered a lot of the things that can give you sciatic type pain. And when you have sciatic type pain, you can have just buttock pain. People have, by definition, sciatic pain is down to the leg, but the pinching of the nerve that causes sciatic pain may not make it all the way down. And so you have buttock pain as a symptom of your pinching of the nerve, disc herniation, pinching. Low back pain, as I mentioned earlier, can refer pain to the hip and vice versa. But pinching of the nerve type pain that causes sciatic pain can also radiate to the area of the buttock and by extension the hip. So those can cause hip pain. Numbness in the leg, again, the nerves come from the back into the leg, and they can be irritated, pinched, or traumatized at any point along their path. And that trauma will or can give you pain and numbness below the level of where it is being pinched or irritated. So if it's up near the spine, it doesn't give you the entire leg numbness, or at least numbness along that nerve, the entire course of that nerve. Or if it's lower, then it's the course of the nerve below, below that. So that can give you numbness into the foot. But there are lots of causes. That's one of the challenges, lots of causes. Someone can say, my leg's numb. A lot of the reasons one can have numbness in their leg. You have to go through the whole process of figuring that out. We have another one. Would it be normal? Would it be normal to have numbness in the foot with no symptoms in the rest of the leg? Well, it's not normal to have numbness, so we don't want to. The numbness would not be normal. But I think the question is really, when you have numbness in your foot, with the rest of the leg being completely, essentially not numb. Well, certainly it's certainly possible. As we sort of mentioned earlier, if the problem is in the foot, the nerves pinching the foot will give you foot numbness, clearly, and then the rest of the leg may not be numb at all because it's not being pressed. But you could be pressed high and just have numbness down in the foot area. It is common enough that I see it, all the time. So when someone says, "Hey, my foot is going numb," I have to think not just of a problem of something in the foot, but something higher up that's just giving numbness into the foot, and the rest of the leg is not, not affected. There's lots of different reasons, for that, anatomic and physiological reasons. But to answer the question, yes, you can have numbness in your foot, the rest of the leg be completely not numb, and have some nerve pinching high up in the spine. Yes, it can happen. And that's one of the reasons why when you're talking to someone, trying to figure it out, you listen to the symptoms, but the symptoms are just the start. You don't stop with the symptoms. You continue to examine the person, look at the different things, look at their spine, look at their x-rays and so on to figure out, hey, is this numbness in the foot? Is that from up high? Is that low? Is it both? What's the reason for that? Could be diabetes. Diabetes can give you numbness in your foot. It's a diabetic problem, certain symptoms that go along with that. So the answer is yes, absolutely. You can have numbness in the foot and not numbness elsewhere, and it still can be from the spine, high up problem manifesting itself in the foot, or some other problem more towards the foot, or maybe a metabolic problem like diabetes or other neurological diseases that can cause just numbness in certain areas and not others. So take it all into consideration. That was a great question. It's a very long topic. I have to make maybe a webinar on that one. That's a big topic. Possible causes of numbness in the leg. That's a big topic. But hopefully I explained it at least partially today. Let's see what else. I think we hit our time. Oh, we got another question. Uh-oh. Let's get it in. Doctor, you said disc herniation is common cause of sciatic pain. Can a small car accident cause herniation and sciatic pain? Yes, the answer is yes. The disc, from a disc injury, disc herniation, disc injuries are common cause of sciatic pain. And discs can be injured by minor trauma. Classically, it's a bending, twisting injury because you're essentially taking the disc, you're squeezing it, and then you're twisting it, and that can pop the disc out. And it doesn't take that much force to do it. You have to sort of hit it the right way, or maybe hit it in a way that the disc is not normally used to seeing. So minor trauma can cause disc herniation. Lifting a piece of pencil off the floor, lifting something, you can give yourself a disc herniation. Major trauma can also cause disc injuries. Again, obviously, they really hit the spine hard, you can cause a disc injury. But generally, when I'm kind of dealing with accidents, car accidents, falls, and this kind of thing, what I usually tell patients who ask me things like that, little things cause, with these herniations. Small trauma can, and large trauma can too. It is the greater the trauma overall, all things being equal, the more likely something would be injured, your spine would be injured. So a little accident can give you a disc herniation. And a big accident maybe doesn't go with a disc herniation, but as the trauma gets larger, it becomes more likely that you can have a herniation. So a very big accident, it's more likely. For a little accident, it's probably less likely. But it's possible throughout essentially the entire spectrum, or nearly the entire spectrum. So yes, small trauma, small accidents can injure the spine and cause them. Not as common as big accidents, but sometimes you'll see someone who has this very large accident. You're like, your spine, nothing, fine. And some people have these small accidents, and you have these big herniations and the pain and severe symptoms right after the accident. So you have to look at the entire picture. But the answer is yes. Small trauma can do it, just like lifting something, bending over the floor, and can do it. I think about a patient I had as a professional football player, and he's getting banged around all the time. Nothing. He was golfing, and he threw his golf clubs into his trunk of his car, like, oh, and he had a disc herniation. Just that hitting it just the right way, or an abnormal twist, can give you an injury you wouldn't expect. So you don't have to be beaten up on the football field to get a herniation, and just after 9 holes of golf, throw your golf clubs and get a herniation and get sciatic pain. So they're all possible. And that's great. These are great questions today. We even went over our time, so hopefully you learned something. Thank you all. We'll do our coffee talk next week. Stay tuned.